Millions suffer from bloating, gas, and unpredictable digestion with no clear answer.
What if your IBS is actually something else? Up to 78% of IBS patients may have SIBO.
This isn't an infection of bad bacteria. It's normal bacteria in the wrong location. Its symptoms are tricky and often mimic other conditions, making a correct diagnosis hard.
Today, we'll show why SIBO recurs and reveal the full strategy for lasting relief.
Let's be clear. SIBO is an anatomical problem. Too many bacteria in the wrong place. IBS is a functional gut-brain disorder. This difference matters.
So, how can you be certain?
Breath tests are common, but definitive diagnosis is invasive. Stool tests won't find it. They check the wrong intestine. But if we can identify it, what's happening underneath? Why do these bacteria end up in the small intestine to begin with? The number one reason is a failure in your gut's housekeeping system. This system is called the migrating motor complex, or MMC. It's a series of cleansing waves that should sweep bacteria down into the large intestine between meals. When these waves weaken, bacteria are not cleared out. They linger and multiply where they shouldn't, fermenting food and creating gas. What harms this system? Things like food poisoning and chronic stress. But it's not just motility. Low stomach acid is another huge factor. Without enough acid, you can't properly sterilize your food. Poor bile flow also has a role, as bile is naturally antimicrobial. Even physical adhesions from old surgeries can create pockets where bacteria hide. This leads to the central problem with standard SIBO treatment. Most methods focus only on killing the overgrown bacteria, usually with antibiotics. This is the single biggest mistake. Attacking the overgrowth without fixing the reason it happened. It's like mopping a flood while ignoring a broken faucet. And the proof is in the results. SIBO has a shockingly high recurrence rate. Studies show 40 to 60% of people relapse within just 1 year. This is especially true for the most stubborn type, methane-dominant SIBO, now called IMO. What makes this specific type so hard to treat long-term? So we see the recurrence trap, but the situation gets even more complex. Let's look at 2 common strategies that can actually backfire. While diets like low FODMAP help symptoms, staying on them long-term is a mistake. It can starve your good gut bacteria and even create food fear. And probiotics? It's not so simple. Some strains can add more fuel to the fire. Blindly taking a general probiotic can make things worse. And SIBO's impact isn't just in the gut. The inflammation and malabsorption it causes can lead to brain fog, fatigue, and anxiety. Finally, we cannot ignore the role of chronic stress. Stress directly slows gut motility and reduces stomach acid, creating a perfect storm for SIBO. So, we have misdiagnosis, deep underlying causes, and high treatment failure. How do we break this cycle and build an effective strategy? The answer is in a multi-phase plan that does far more than kill bacteria. Recall the broken MMC we talked about? Any successful plan must address it. Phase 1 is reducing the bacterial load. This can be done with antibiotics, but research shows herbal antimicrobials can be just as effective. To make these treatments work better, we can use biofilm disruptors. These break down the protective shields bacteria create, exposing them directly. But preventing recurrence is the main goal. This means supporting your MMC. One powerful method is strategic meal spacing, giving the gut 3 to 4 hours to cleanse. And that stubborn methane SIBO? It's caused by archaea, not bacteria. They are harder to kill and have a profound slowing effect on gut motility. So the winning strategy is clear. 1. Reduce the overgrowth. 2. Stimulate motility. And 3. Address root causes like low stomach acid and stress. SIBO is not a simple infection cured with one round of antibiotics. It is a complex condition born from underlying dysfunction and requires a complete solution. Your symptoms are real. They are not just in your head. And they are not just IBS. They are signals of a deeper imbalance that can be fixed. The objective is not to live in fear of food, but to restore the underlying function of your digestive system. True healing means fixing the system. Take this knowledge to your healthcare provider. Ask about breath testing. Discuss plans that go beyond antimicrobials to fix motility and root causes. Patient education is critical for managing chronic gastrointestinal conditions and preventing diagnostic delays in complex cases of small intestinal overgrowth. Understanding the why behind SIBO is the first real step toward reclaiming your health.